Hey, this is Matt Rickerts here at Competitive Edge Physical Therapy, and today we're going to be talking about baseball pitching and one of the big injuries you see in baseball pitchers, which is the dreaded medial ulnar collateral ligament injury in the elbow, also known as the Tommy John injury. So why is this important? Well, you're seeing a big increase in the number of Tommy John injuries in the last 20 years, both on the professional level and in youth sports. And since 2001, I think about 75 pitchers in the major leagues have needed a Tommy John surgery, which is about 1 in every 9 pitchers. And when you look at the recovery for this, it's taking about 17 to 20 months for these baseball pitchers at the elite level to really come back from that type of recovery, which means they're missing at least an entire season, and it's really becoming quite a big issue. So it really begs the question, are there some risk factors that we can know about that are going to help prevent a Tommy John injury, and is there anything we can do about it? And the answer is yes to both of these. So it's actually what we're going to be talking about in this 3-part video series. So today we'll be talking about these risk factors, and over the next 2 weeks we'll be talking about proper pitching mechanics that can help eliminate that, as well as some exercises. So what are these risk factors? Well, one of them is the carrying angle of the elbow, which is the angle from kind of the upper arm as it kind of draws outward a little bit going down into the forearm here. Other ones are also high pitch count, higher pitch velocities, and as well as improper pitching mechanics. So for most people, the carrying angle for males is about 5 to 10 degrees. For females, it's about 13 to 15. And if you're seeing that angle at above 15 degrees, you're kind of at risk for really putting more strain, a valgus strain, which is kind of this inside out strain on that elbow during a pitch. And when you go through the pitching motion, you're already putting a lot of this valgus torque on the inside of the elbow. And if you have more of that valgus happening at the elbow, it's going to put even more torque. So it's been shown that through just a normal throw, you could produce about 66 Newton meters of force on that elbow in the valgus direction. And if you look at cadaver studies, it's roughly been shown, not quite exact, but some studies a little more, a little less, about 33 Newton meters. Regardless, it doesn't really matter. It's that it's under 66, which means every throw you take is putting more stress than that ligament can withstand, which means that you have to have something else, either the muscles or some of the other surrounding tissue to help support them. So although you can't change the carrying angle as a risk factor, you can work some of the musculature both in the shoulder and in the arm to help reduce the strain on the elbow while pitching. So that's good news, it is a risk factor that you can change. Some of the other risk factors, higher pitch counts, higher pitch velocities, they're a little more ambiguous in the literature, but it has been shown that higher pitch counts, more innings pitched, and pitching 8 months out of the year have caused more medial elbow injuries in youth, but that's not quite the case in the elite levels, most likely because of higher training and higher pitching mechanics, better pitching mechanics. So what does show in the major leagues though is that higher pitch velocities, no matter what type of pitch you're throwing, whether it's that fastball, that split, the curve, as long as you're throwing faster, you're going to put more strain on that collateral ligament, producing more injury. So that kind of makes sense, as well as the pitch count too, because if you're pitching with more pitches and not allowing enough time for recovery, you're causing some micro trauma on that ligament on the inside of the elbow, and over time that could just kind of wear it out, leading to a rupture anyways. Same thing with throwing harder, that's going to put more stress on that valgus angle as you're going through the pitch, and more strain on that ligament, and eventually that could rupture. So really looking at lowering pitch counts, obviously velocity you want, and you can't want to change, but that's something to look at with pitching mechanics that you can change. So pitching mechanics is something to talk about too. It's another risk factor. There's about 4 different things you want to look for in a pitch. The throwing motion that can change and put a little more stress on that ligament. But that's a really complex issue, so we're going to be talking about that next week. So definitely stay tuned for more information and great knowledge on pitching mechanics next week. But if you're more interested in learning about pitching mechanics and medial elbow injuries, definitely come check our state-of-the-art facility here in San Jose, or check us out online at compedgept.com. All right, thanks.